Beautiful afternoon to you. So glad to have you join us on the program Healthy Living with yours sincerely, Oluije Oihohai. Now, health is all about you taking care of yourself, exercising, staying on a normal diet, yes. And some persons, they'll feel like exercising, okay, how do I do exercising? And some others, they'll start exercising and on the long run, they decide to cut it short all because we call the word procrastination. Now, you don't need to procrastinate. You want to go on a diet, you want to start jogging, you want to take good care of your health, you just need to start now. All right, today on Healthy Living, we're looking at something very critical, something very crucial, something that some persons, they tend not to, think towards and look at the case critically. Now we're looking at eye cancer. Now to do that for us, educating us more on eye cancer, how it's come about, the importance of taking care of your eyes, and also when it comes, how are we or how do we know about it, the symptoms, the causes, and if there are possible remedies. Now to do that for us is the person of Dr. Ugbebo Uwamari. She is the senior optometrist, Brillia Eye Care. Good afternoon, Dr. Ugbebo.
Good afternoon, Madam Hiloji.
Okay, so how are you doing?
I'm fine, thank you. And how
Okay,
are
now
you?
quickly. Hello?
I can hear you.
Can you hear me?
Yes, I can hear you clearly.
Okay, thank you. Now, Dr. Uwai, quickly now, some persons hardly take care of their eyes. They feel like I can see. I know I can see the four letters. I can see 1, 2, 3, A, B, C, D, and all of that. How can one take good care of their eyes?
If you want to take good care of your eyes, it's very easy. It's very easy. We usually advise as eye care practitioners that at least twice in a year you should
Okay.
see an eye specialist. Sometimes there are a lot of conditions that occurs to the eyes that we don't want to actually blame you for it, but on the other hand, we have to blame you for it because if you had gone for a checkup, it would have been diagnosed. So it is advisable that everyone, if you even if when you think that your eye is okay, for you to visit an eye care practitioner at least twice yearly.
Okay. All right, so let's dive into the question, the matter for today, eye cancer. What is eye cancer?
Okay, eye cancer is actually a topic that is not so talked about. I know a number of times I've come on air, and this topic has really not um, been a topic to talk about. So it's a good thing that it's coming up today. At least persons still need to know about eye cancer. It's already happening to some persons, and I just hope that they are on air today listening to this broadcast. Eye cancer, when you hear the word cancer, cancer has to do with a growth. It must be a growth. It refers to a growth and it has to be a cancerous cells within the eye or the surrounding areas of the eye. So an eye cancer is a cancerous growth in the eye or around the surroundings of the eye.
Okay, now when we're talking about eye cancer, now before it deviates to cancer of the eyes and all of that, there must be some symptoms that this person must have noticed. Maybe swelling of the eyes or some other itching of the eyes. So what are those things that you need to tell the person, okay, this is where it's tilting to. You need to come to the hospital. What are these symptoms that this person needs to know, this person needs to see?
Okay, first of all, there are different types of eye cancers.
Okay.
But no matter the types of eye cancer that present, they all have a particular, the same type
Symptoms.
of symptom. Yes, it
Okay.
presents the same way. So first of all, there's blurry vision. And you know, a lot of eye conditions their symptoms usually mimic. So blurry vision, anybody having a refraction error can have blurry vision. Anybody having a cataract, glaucoma, they can have blurry vision at some point. The same thing with the eye cancer. Eye cancer also presents with blurry vision. Okay, so other symptom. Now there's this black part of the eye, that's the middle of the eye. At the middle of it, there is a hole that we call the pupil. So as eye care practitioner, when we want to investigate the eye, we look at the pupil, we look through the pupil to the other parts of the internal features of the eye. So with a cancerous eye, you would notice that that part of the eye
Yeah, go ahead. We can hear you.
opaque, and also it can also become yellowish in color. So when you see signs like that, or even symptoms, because if a light is shone on the eye, or probably a photographer takes a picture, it can show that the color of the eye is not the normal color, it's either white or yellow. But at the same time, like I said, you must need a differential diagnosis for you to be able to distinguish it from other or differentiate it from other eye conditions that present the same symptoms. Then also, there's the symptom of crossed eye in the sense that the eye is not looking straight. They call it upper swan eye. It's also a symptom of eye cancer. Then there's redness in the eye, and most of all, there's swelling of the eyeball. It's that swelling of the eyeball that usually rings a bell for you to think that there may be something of this sort even before the doctor can make a clinical diagnosis. Just walking in, the doctor will first of all have it in mind that, oh, for this eye to be swollen, it means that there's possibility to start querying cancer of the eye.
All right. So, what are the risk factors for developing eye cancer? What are the risk factors?
Okay, so the risk factors, they are the causes as well for developing eye cancer. First of all, we have genetic mutation. So it's the most common cause of eye cancer. There is a particular protein in the eye that is produced, and it helps to regulate cell growth, and it also helps to prevent uncontrolled growth and cell division. So when this gene is mutated, it means when the gene is changed in form, it can make the cells to just grow uncontrollably, and this will lead to cancer. Then we also have cases of eye cancer being inherited. In like 40% of cases, we have it being inherited. Then we also have sporadic cuts. It can just come on its own. When it happens, there is a mutation in the gene. Of course, when this happens sporadically, it's usually in one eye. But in the case of genetic cases, it can happen in the two eyes. Then we also have, as a result of age and development, in children that are less than 5 years old, they are at a risk of developing eye cancer. And when the gene is also susceptible to genetic changes at this age, it can also make that child to be at risk of developing eye cancer early enough in life.
Okay. So, what are the causes of eye cancer? Some persons,
Okay,
they will be
exactly what
at
I'm addressing.
a phase of saying, okay, it could be I look too much to the direction of the TV, some others to the lights and all of that. So, what are the causes of eye cancer?
Okay, in addition to what I just mentioned, because what I just mentioned, they're both the risk factor, which is the genetic mutation,
Okay.
inherited cases, then sporadic cases that can happen sporadically, and also age and development. There's also that the
Okay, we can hear you. Go ahead. Go ahead. Dr. Wall can hear you. Hello, Dr. Wang. I'm talking about latest development and advancement concerning eye cancer. What are government organizations putting in place to see that this awareness is being known to the populace?
Okay, so a lot of times when we have our global programs, when we have our World Sight Day activities, we have our World Glaucoma Week, we raise awareness for all eye condition and not just that particular eye condition in the context. We raise awareness of all eye conditions, symptoms and signs to watch out for as an association, and also this of us achieving persons with good eyesight rest on the onus of the general public being aware of their own conditions and reporting. There are different types of eye cancers. There's the retinoblastoma. You know your eye is normal, and then all of a sudden you start noticing that the eye is becoming swollen. Why won't you report to the clinic? You should report to the clinic. By so doing, you're helping us as eye care practitioners, and you are also helping yourself in the long run to preserve vision, because it is not an easy task to be going about with poor vision. Recently, the women optometrists in Nigeria, Edo State chapter, we celebrated persons living with visual impairments in our community. Edo State chapter, of course, we worked with the Nigerian Association for the Blind in Edo State, and retinal blastoma, which is an eye cancer, some of the diagnoses of these persons living with visual impairment. So we don't want the numbers of people having this eye condition to be in the increase. And so we are always advocating for better eyesight, as in you have a right to good eyesight. And even in cases where it is genetic, there is also possibility of you getting back your eyesight if only we diagnose this condition on time. But you cannot be at home for us to diagnose your condition. You have to report. You have to report to the hospital for us to get your condition diagnosed. So,
Okay, now when someone always talk about constant headache, you find the person saying, "Oh, I always have headache. I have headache on my forehead and all of that." Now, is it attributed to eye cancer or attributed to a way that the person needs to know that you need to go see your optometrist?
having frontal headaches, headache at the forehead, like I said, it's a normal thing medically. A lot of symptoms, a lot of signs, they mimic each other in reaching out to your diagnosis. So we cannot just use headaches to make a diagnosis, but it can also be one of the signs or one of the symptoms that should be reported for us to make a differential diagnosis. So if you are having a headache at the front of your head, you can report. You can report to the clinic, and several tests will be done on you in order to make a good diagnosis of what the problem is.
Okay, now we found cases of lots of persons that complain about their eyesight, and you hear friends advising, "Oh, just go to the roadside and you'll be able to get a good, maybe a medicated glass for yourself." Now, is that a good method? Is that a good, is that hygienic enough for the eyesight?
Okay, so in a way to curb that, in a way to curb that, it is not a good practice.
Yeah.
So in a way to curb that, what we do is the vision screening that we do. We do a lot of vision screening. Now, if you believe that if you go to the roadside, you can be able to get glasses to use to see effectively, and
Yes.
you don't want to go to the clinic to get your eyes checked because of probably the cost involved, then you can attend the screening that optometrists other eye care practitioner put up. And when you do that, you'll be able to get your eye checked first of all without any payment, and then your right prescription will be issued to you. We also make them to feel that, okay, you want to use the roadside glass and you don't know the lens power that you need for your age. If you put on a lens power that is not for your age, you will definitely have a headache. As I am, it's difficult for me to use someone else's glasses because if I do it, just give me 5 minutes and I develop this serious headache. Normally, I would think it happens to everybody. So I don't think why they should still adopt that practice of just going out to get a glass that they will use for reading. I don't think it's appropriate. You thinking that your eyes are not working, well, it's just an opportunity for you to have something to complain. At least if you say my eyes don't have problems, so I don't need to go to the clinic. But now you notice that you cannot read that tiny print that you know you could read before now. It's just an opportunity for you to go to the clinic and then you have at least a complaint to tell your doctor so that your doctor will now know what to do for you. So
Okay, okay. Can we
it's
say that eye cancer is hereditary?
yes, in some cases, eye cancer is hereditary. Or in yes, it is hereditary. The
Okay. So what would you
retinoblastoma case.
advise one that has such cases?
There are different means of tackling eye cancers, and there's possibility of recurrence even after treatment. There are different types of treatments. We will leave that for the ophthalmologist, chemotherapy, and all that. Surgery, so if you have the opportunity, if you have a eye cancer that has really reduced your vision for a long time and you are given an option to carry out surgery that can help to improve on your vision, at least for you to be able to do the basic things in life. I think anybody that is well funded to go on with that surgery should do that, because there's no point suffering yourself when actually there's a way you can actually get solution for the problem. Even if there may be a relapse, but then you would have enjoyed your eyesight again for quite a good number of months or years, as the case may be.
Okay,
It's
so
not a
what are your
really
advice to persons out there who are watching us right now to know what they should do about their eyesight and also care of the eyes? Now, some persons, they tend to say, I don't want medicated glasses. So instead of using medicated glasses, what other options are there that one can make use of?
okay. I'll just give an instance. If you're having if you're having a headache and you say you don't want to use paracetamol for your headache, or if you're having a malaria and you don't want to use injection or any other form of medication to take care
Medication,
of those
yeah.
conditions, so what will you be using? Will you use eye drop to take care of malaria? No. Will you use glasses to take care of malaria? No. The same thing applies in eye care. We have eye drops to take care of conditions. Some condition depends on your diagnosis. We have tablets to take care of condition depend on your diagnosis. We have surgical cases. Then we have glasses to take care. You can see how my glasses looks fine on me. It's about you getting something that fits you. People will not laugh at you that you are putting on glasses. And even if they do, you know what you're achieving from using that. It is better you use it than for your visual condition to get worsened. So if the doctor has diagnosed you and said that you need to wear glasses, then you should go with glasses, because there's no other thing that you can use. Glasses like drugs. There's no other thing that you can use that will take care of your refraction error apart from glasses. The same thing if you're having some form of allergic conjunctivitis, or if you're having viral conjunctivitis, the doctor tells you get these particular eye drops. So if you say you don't want to use eye drops, then I don't know what you will need to use at that time. So there is a lot of patient that gives us this tough time because they don't want to follow what the doctor has prescribed. and then they will still report back to the clinic, still having the same signs, still having the same symptoms, and they want you to perform magic for them. That's not possible. If you cannot listen to your doctor when your doctor is trying to manage your condition for you, then the doctor, you leave the doctor with no choice on how to make your condition better for you. So it's good for you to always listen to your doctor's advice. Any diagnosis that is made and any treatment plan that is made should be adhered strictly to if you really want to take care of yourself. That's what I see.
Okay, now a quick one to parents. Your advice to parents. We know we have kids out there who complain a lot about their eyes, their sight. Now, what would you advise parents out there?
Okay, so not just parents, teachers in schools, guardians as well. So you can at least notice some kind of strange behavior of your children when you're in the living room watching television, for example. You see your child walks up to the television in order to get a clear view of what is happening. You see your children, they use phones a lot now. You taking the phone very close to the eye because he wants to appreciate what he or she can see. You see your child always like itching the eye, scratching the eye. Then these are things for you to watch out for. Then in the classroom, a child is not able to copy from the board at a particular distance. As a teacher, it's your responsibility for you to probably write a note. Maybe it's not the parents that you see often, they just drop their kids off and leave. You can write a note and give to the child, to give to the parents, or you can talk to the parents directly about the condition. In doing that, you would have helped that child a lot. It's very difficult or for children to make decisions for themselves. It's the parents, the guardian, the teacher that can be able to help them do that. And when condition comes up very young like that, and you handle them properly, you'll find out that you've done so well for that person, and the person may even recover. I remember when I was in secondary school, throughout my stay in secondary school, I was astigmatic, and my parents took me to the eye clinic, and I was given a pair of glasses that I used throughout my secondary school. But when I was done with my jam, O level, and all that, I was not doing so much of book work. And at that time, I discovered that my eyes were seeing better because I was faithful using my glasses. But throughout my stay in the university, I didn't put glasses on my eyes for once because I got a correction for my refractive error because I used my glasses. There are some simple cases of refraction error that you just need to wear glasses for some time. And also, depending on what you expose your eyes to. When I was growing up, I was not used to phone. We were not used to phones because
Okay.
phone then came out. It was landline. So we were not exposed to those UV lights,
All
and we are
right.
not also used to computers. So that way we are preserved more than now that even school children, they are given assignments and they want to google everything. They
Yeah.
want to use the phone, they want to use the computer at every given point, and their eyes are being exposed. It's
Okay.
good for you to just take your child for checkup. It can just be a little condition that can be taken
Corrected.
care of by simply using glasses.
Okay, okay. All right, thank you so much, Dr. Wa, for taking out time to educate us more about eye cancer and also care of the eyes. Now remember, health is wealth. Health is wealth again. Till we'll see you again next week for another exciting time on healthy living. Do have yourself a blessed day. Bye for now.